What a rich day we've already had, and now we have this panel to sort of close some gaps in our thinking and address all sorts of different angles. I'm going to direct my question to Sara Czaja from the Weil Cornell Medical College. Sara, you bring a lot of expertise in intervention work to the table. And so the question really relates to, can you talk a little bit about the importance of partnerships and interdisciplinary teams and technology-based interventions using a systems approach, and also include in that a perspective on training and education?
Sure. Thank you, Nico. Happy to talk about that. Well, I think we saw today in all of our examples that when we're using these systems approaches, it really involves the interplay of a multitude of different players, from policymakers to government representatives, the modelers, academics, and also community representatives and people from the healthcare arena. And I think to push systems modeling forward and to make the process happen, and we found this in our own intervention work, which is, these are complex problems, so you need multidisciplinary teams and input and approaches. But what's really critical there is you got to think about upfront, just as Doug said, upfront with dissemination, upfront on how are we going to get these different players to communicate effectively. I mean, people are coming from different arenas, different roles. They have kind of their own language. And I think in terms of training and education, it's important to have a little background and training on what these roles are, what these players bring to the table, and to really understand what are goals. What are the goals here, not just from the modeler perspective, but from other people's perspectives, and what kind of constraints are operating, and how do they vary from situation to situation. And I think two other things that are important besides thinking about how do I get these people to talk together in the same language, which, I deal a lot with behavioral and scientists and clinical researchers, and because our interventions are technology-based, it's very difficult sometimes to have our clinicians speak with my computer programmers because they come from such diverse backgrounds. So I think, getting people on the same page and able to communicate is one thing, but I think it's also important from the outset to manage expectations. Okay, if we're going to have community involvement in these kinds of programs, we have to figure out what are their expectations. How is their input going to be used? To what degree can we integrate their input? It may not be possible. It's not always feasible. And I think people need to know up front we have to understand each other's expectations and how they're going to be handled in the modeling situation. And finally, I think we need to think about how do we keep people engaged and involved? And especially because some of these processes are complex, they evolve over time. So how do we keep people in the loop? How do we keep them involved and motivated? And I think that kind of also dovetails on what Doug said. If we're going to keep involved people, we have to keep them motivated, informed, and we also have to have them feel that their contribution that they're making a contribution to the process. Thank you.
Great, thank you.